tightness. We're going to add some longer acting anesthetic. So instead of wearing off in a couple of hours, he'll probably have the effects of the anesthesia up to 4 or 5 o'clock this afternoon. It's now about 9 o'clock. And also, I'll provide him with some pain medication. And we suggest that before even the pain starts, the patient starts themselves taking a little bit of the pain medication, and usually they have very comfortable evening. Also, we're going to ask him to use ice in the area of the suture line, and that prevents a lot of the swelling, and swelling is probably part of the component of pain that we can minimize with the ice.
And as far as washing your hair and taking a shower?
He will start washing his hair tomorrow. The only difference is that I do not want him directly in the shower. He will use a cup with minimal pressure, because the grafts that we're going to place on top are going to be planted in a 1 millimeter incision, and it takes about between 2 and 4 days for that incision to be completely healed. We wanted to keep it clean, but after 4 or 5 days he will be able to wash as normally as he usually does.
And you said those sutures dissolve?
Yeah, these sutures that we are using in Eric are absorbable material. Usually we take them out about a week to 10 days later, but Eric is going to be on vacation, so this will work about the same. There's a little bit more reaction from absorbable material, and sometimes the scar tissue is a little bit bigger, but with this new technique and placing the stitches very, very close together like we're doing, I am hoping to minimize the scar.
How many stitches are there?
A lot. Probably about 40. But we run them almost like running a baseball. We just have two knots at the beginning and at the end.
Oh, okay.
Pretty amazing.
It is amazing that you can remove close to 2 or 3 inches of tissue back here to do transplants, because patients that have significant hair loss can have between 4 and 5 procedures.
And what are the girls doing right now?
The staff is dividing the grafts into the from the large donor area strip that we removed. They're dividing, and I will show you that in a couple minutes. Because it takes a couple of hours for them to divide the tissue into the individual follicular units.
You want me to go in there and get any footage of that?
Yeah, you can if you want to.
Is there anything I'm going to miss here?
No.
This is one follicular unit.
1644 expiration.
If you can tell, but the bottom is here, and then the little hairs are coming out.
It can have the little CVV number on the back.
Yes. What we do is
And can you just verify
we take
your
the
address
tissue
for
and
me?
we cut it in 4s, so we can get a quarter count basically for Dr. Weinstein, so he knows how many incisions to make. And then we cut them in
And that's also the
slices
billing
like we
address
call
for your
them bread.
card? Okay, because our new machine.
So we have small slices like this that we cut,
we'll get
and
that
then
in
we
today's mail
dissect
for you
each
then.
individual hair follicle. And then I have piles. We
With
have
the 205.
smalls, which are 1 to 2 hairs, and then largers, which are
The
like
perfume,
3 to 5
sure.
hairs.
Okay, we'll get it in today's mail.
And once we're finished this
You're
quarter,
welcome. Bye-bye.
we'll count, and then
Can I help you?
that'll give us an average of what we're going to get for the whole case.
I think you have the wrong Weinstein. This is Franklin Weinstein. We do hair restoration. Sorry, thank you. Okay.